There are many ways exercising can help when you have rheumatoid arthritis. Research shows it can help by giving you strength, flexibility, reduce pain, reduce inflammation, increase energy, reduce your weight, or at least help you manage your weight, help you with balance, mood, and sleep. Each of these are helped by exercise when it's done well because it treats the root cause, chronic systemic inflammation. However, exercising comes with many challenges when you have rheumatoid arthritis. It can be painful, especially at the start, and then it's really hard to motivate to do something that will make you feel worse right away. Flare-ups that you have with RA can cause deconditioning. This is the invisible side effect of every disease that limits your physical activity, but it's only noticed when you're feeling better and you don't have the same mobility, stamina, and strength that you did before. This can be really disheartening and frustrating. And then there's these associated conditions with RA and medication side effects that can affect your mood, your energy, your motivation, and your ability to keep up with those you love, making it harder to be motivated to exercise. All of these challenges of exercising with RA mean that the advice to exercise when you have RA can put you in a stress state, even just thinking about it. And that stress state causes inflammation. We don't want exercise, even thinking about it, to add to this chronic systemic inflammation. So yes, exercise is great when you have RA, when you know how to be exercising well. It's important to recognize that stress, that physiologic state, shifts your whole person. Your brain starts looking in the past and the future for solutions to a threat. In this case, the threat is your own body, making it really challenging to find a solution. But your body, when you're in a stress state, is ready to move. That fight, flee, freeze state is your body holding tension, ready to move. And so we can't just think our way out of stress. We need a way to mindfully come back to the present moment so that we can listen to our body. And we need a way to move that lowers inflammation, that helps to use that tension to reduce inflammation and clear that stress state. So that combination of mindful, science-based movement, when you're doing it with that mindset of self-care, that you're doing it to take care of yourself, is that magic formula that allows you to be exercising well, to use exercise to be in the well state from the very start so that exercise can lower inflammation rather than being a pro-inflammatory. So how do we do this? Well, the whole person solution is the Be Well Now method. This method is a 3-step method that ensures that you are using everything that you know inside to start in the well state and stay in the well state as you're exercising. The first step is the B step. This is where we come into presence, which is very difficult when your body's not feeling the way you want it to do and not able to do what you want it to do. Mindfulness is the kind of presence where you are meeting yourself where you are. You're just taking in what's going on with this sense of curiosity and kindness, meeting it with kindness. That's mindfulness. It's the equivalent of saying to a friend, "Oh, I'm so sorry that you're going through this. What can I do to help?" Okay, that's the way to think about mindfulness. So take a moment now. So we start in the well state, that you just pause. Put your body in a position where it can rest. So it feels like your bones or your body is just holding you with ease and your muscles can rest. So position your body that way and just feel your body taking care of you as best it can right now. Feel your breath moving in and out and just recognize all the ways that your body is taking care of you right now. And so as you feel your breath moving in and out, drop into this present moment awareness. And anything that you notice that's challenging, practice noticing it, getting curious about what your body's trying to tell you, and respond with that kind response that you give to others easily. What can I do to help? So take a moment to just feel your body, feel your breath, and practice noticing the full range of what's here now and responding in a way that you are listening to your body. Now, acknowledging that this is challenging. This is very challenging when you have a medical issue, when your body is not feeling comfortable. And so this is why self-compassion is shown to really help with making lasting changes, but it also helps to start that process to go from the stress state to the well state. So mindfulness is that first step because it initiates that journey from the stress state physiology into the well state. It doesn't complete it. As we get through the steps of the Be Well Now method, it will. But we start with mindfulness. So we start that process and we start with this sense of open listening to your body. Okay. So just notice, take a moment to notice what's working well right now. In the show notes, I will link a worksheet that you can use for this if you want to write it down. But just notice what's working well. What medical treatments are working well, or medical providers have you found that have been helpful? What are you grateful for? What mindsets are helping you? What are you telling yourself? What self-talk are you using? The mindsets that are helping. What movements can you do right now with these? What areas of your body can you move that maybe have less pain or no pain? And what's motivating you? So take a moment to just notice what's going well in those 4 areas, and then notice what the challenges are. What are the challenges and frustrations with medical treatments or providers? Write those down, just being aware. And then noticing what mindsets maybe are not helping you, what self-talk is maybe creating more stress. What movements are stressful right now that you want to be able to do, but they're a little stressful? And what are you struggling with motivation? What are you knowing that you should do, but you're not doing it? What's stressful there? So having this full awareness in this step of just noticing the broad range of that there are things that are going well with medical treatments, with mindsets, with movements, and with motivation. And there are things that are challenging and could put you in a stress state. That awareness is tremendous because you know what puts you in the well state, what puts you in the stress state. Okay, so just take all that information in. We're going to use it. And then the next step, the well step, taking a moment to notice what's most important to you. You are going to get a lot of advice about how to manage RA. And a lot of people telling you that you should exercise and what you should do. And it can make it very stressful because it's overwhelming. There's a whole long list of things that you should be doing, and you've got these barriers, things that are getting in the way for you. And so take a moment to weed that out. What is most important to you right now? What do you want to be able to do? Who do you want to be able to do it with? How do you want to feel and function now? That's most important to you. What comes to mind? Just write that down or think about that. Get back down to that heart level knowing, what you know inside, beyond your thoughts of all those shoulds. Let's get back to that, what you know in your center about what is most important to you. What do you value most right now? Where is it worth putting your energy in right now? And just notice that. Just take that in. Okay, now we take all that information and we use it to make sure that you are exercising in the well state. And we add a little bit of movement science and motivation science here to make sure that the movements that you're doing are not triggering the stress state, not being pro-inflammatory, but being anti-inflammatory. So we take that mindfulness, we take that sense of knowing what you value, and then we use that while you're moving. So you're not just doing it and not pushing through pain, which is surefire ways to increase inflammation with exercise, but you are exercising in a well state by using that information. So there's 5 tips that I have here for you in this step to make sure that you are exercising in the well state and reducing inflammation, not raising it. So the first one is do a balance of mobility, strength, and stamina. You will hear advice that maybe it's really good to do pool exercise, or it's really good to do stretching or yoga. That's great. There's many types of exercise, but our body needs 3 skills. It needs mobility, it needs strength, and it needs stamina. When our bodies decondition, that downward spiral of inactivity leaves you with less energy, less mobility, less strength to move, and then you don't feel like moving, and that's why it's the downward spiral of inactivity. But we can turn it around, but our body needs all 3. Our body uses mobility, strength, and stamina with everything that you do. All those activities that you listed need a combination of mobility, strength, and stamina. It might use one more than the other, but if you want to go hiking with your family, yes, you need stamina for that, but you also need mobility and strength. So when your exercise starts with that foundation of those 3 types in the right balance, then you have the best chance of feeling better. Mobility is stretching and balance exercises. Strength is lifting weights, but not right away. I'll talk about that in a second, but somewhere that you're challenging your strength against a resistance. And then stamina is anything you're moving continuously for more than 3 minutes at a time at a moderate intensity for your breathing. So the first step is, how am I going to do a balance of all 3? But if that sounds overwhelming, continue on these next steps because we're going to make sure that it is not stressful. The second tip is to make the moments count. You've got limited energy and your body has this very small window where movement can lower inflammation. If you start doing too much, it will raise inflammation. So you want to stay in that window and you want to make sure that the movements that you're doing are aligned with what you value most. So going back to that list of what you want to be able to do and who you want to do it with and how you want to feel and function, take those movements and we'll turn them into exercises. So break them down into the smallest, easiest component that you can do. If you want to hike on a trail with your family, then you need to be able to walk, but not walk on a bumpy trail right away, maybe walking on flat ground and starting with that. So you see what I mean? We'll break down those movements into the smallest components that you can do right now. And do it with each of those with mobility, strength, and stamina. So one way we do this is not going by the common approaches to exercise muscles, right? You'll hear strengthening exercises that strengthen different muscle groups, like your quadriceps and your biceps and triceps. That's a bodybuilding way. It's not going to teach our body to function well. We want to train movement. So think about the movements that you want to do. We'll break down those movements into mobility movements and strength movements rather than doing the muscle group approach to strength and stretching. That will help you think about your whole body and get your brain and body working together again so that your muscles all know how to work together like a symphony to create movements to make moving easier. Okay. So we want to think about the movements that you want to do, break them down into the smaller components. And then the next step is to meet yourself where you are. This is the third tip of how to exercise to be well now with RA. Meet yourself where you are. This is quite possibly the hardest thing to do when you have a medical issue that limits you physically. Your brain remembers what you could do and it knows what you want to do, but your body knows what you can do now. And that's where we use mindful self-compassion to say, all right, I don't like this. I want to be out there hiking with my family and doing that without thinking, like I used to, but my body can't do that right now. And this is hard, but I'm going to listen, body, and I'm going to give you the steps that you need to get back there. Okay. So meet yourself where you are and listen to your body so that you can move in a pain-free or a pain-reducing range. Pain is one of our best guides. It will tell you if your body is increasing inflammation or decreasing inflammation. So if you're pushing through pain, it will never improve pain, especially when you have RA, because it's causing inflammation. It's feeding the root cause of that issue. So we don't want to push through pain with RA. Now, so you might have some stiffness in the beginning of movement. So if it's pain reducing, as you move, the pain starts to dissipate. That's how you know you're using it as an anti-inflammatory. But then if you continue to move and pain starts to return, then it becomes a pro-inflammatory. So there's this sweet spot there that you can only find when you listen to your body and you respond in a way that says, okay, body, I don't like it, but thank you for telling me that I've got to slow down or I've got to stop. I've got to take a little break because inflammation is rising. Okay. So think of pain as a guide. Meet yourself where you are and start in a way that's pain-free or pain-reducing. I can tell you that the place I find people really run into trouble with this is when they start doing classes or exercise videos, or even working with a trainer to start one that just thinks that they have to push them through. It's often too much. What your body really probably needs is just a few minutes of movement at a time in small bouts throughout the day. So doing a half-hour video or a 1-hour class or working with a trainer for a half hour generally is too much. So these small bouts many times makes a big difference. So I want you to think about the type of exercise that you can do or the type of movement you can do that's pain-free or pain-reducing. The one that you think you might be able to do for a small amount of time. Okay, maybe you could walk for 3 minutes, not 5 minutes or 10 minutes. Or maybe you can do range of motion type of stretching, but holding a stretch hurts more. Or maybe you can do strength exercises without any weights, but holding weights hurts. Okay, so reduce it to the type that you can do, the level or the intensity of that exercise, the duration, how long you're doing it for, and the frequency. You have those 4 variables to play with: the type, the level, the duration, and the frequency. You can play with those variables until you're able to find what you can do in a pain-free or a pain-reducing range. It might be 5 seconds. That's okay. Get down to that first level of that pain-free, pain-reducing range, and that's your starting point. Give yourself lots of kindness that that's not the starting point you want, but it's the starting point your body is telling you that that's what it needs to be able to lower inflammation. The fourth tip is to progress gradually in a pain-free or pain-reducing range. Our brain thinks we can do more than our body can. Our body knows exactly what you can do. So 5 to 10% is the recommendation. Our body physiologically can adapt to about 10% increase in exercise per week. That means if you're walking for 10 minutes, 10% would be 1 minute. Okay. 30 seconds would be 5%. With somebody with an illness, like an autoimmune illness that is kind of, very, can be triggered easily by doing too much movement, we really recommend doing 5% at most per week. So the bottom line is that's very little. You don't have to do all the math. Just know that it's much less than what your brain thinks you should be able to do. So make it really small, those micro progressions. And then when your body says, no, thank you, if you progress, then you go back. Maybe it's a 0% increase week. Maybe it's even lowering it for a week while your body kind of catches up. There's many things that are affecting your inflammation. So this is variable. And that's why we have these variables to play with, because things like food and stress and environmental triggers are going to trigger inflammation. And so we want exercise to be flexible enough that it can be anti-inflammatory and meet yourself where you are depending on what inflammation state you're in right now. Okay. We want it to be a treatment, not a cause. And that's why we have these variables, because our bodies change day to day. So listening to yourself with mindfulness lets you use those variables so that exercise is pain-free or pain-reducing and can be helpful anti-inflammatory. And then the fifth one is notice. Your body will give you signals that nobody else has. Even the brightest, most brilliant rheumatoid arthritis doctor or physical therapist does not know how your body feels in the present moment. Only you know. And only you know what's important to you. And only you know how you feel. So by noting what you did and how you felt, writing it down lets your brain learn a little bit easier. It lets your brain see what you're doing and how you're feeling. You could also say it out loud. So if you're really resistant to writing things down in any way, I took a 5-minute walk and I felt better. I did these strength exercises and I felt some pain. And that information is going to help your brain, help your body to adjust and make those adjustments so that exercise can be anti-inflammatory for you, meeting you where you are. So either write it down or say it out loud, use words, use emojis, anything at all that lets you really notice and learn from what your body is telling your brain, and help your brain help your body to adjust, to use exercise to be well now. So some key points from this. RA symptoms are caused by chronic systemic inflammation, stress, stillness, and over-exercising or doing too much movement increases this inflammation. Exercising well is using mindful, science-based movement done as an act of whole person self-care, so that you are willing to adjust so that that movement of mobility, strength, and stamina can be done as an anti-inflammatory. And we do this by doing small moments in the day with a balance of mobility, strength, and stamina exercises to have more moments of the day with less inflammation and greater healing. If you're looking for guidance with this approach to exercising, to use it to help RA, to lower inflammation and restore your strength, stamina, and mobility in a way that you're well from day one, check out the Start Well program. It's designed to take the stress out of exercising and start you with a strong foundation in the well state. Thank you for joining the Be Well Now Method podcast. Share this with anyone you know with RA who could use a little bit of good news information about how to use exercise without increasing stress, but by decreasing stress. Have a great day. Be well now.